If you enjoy our podcast, please like and subscribe and consider becoming a digital subscriber to the Albuquerque Journal to help us bring you more content like this. You can find this episode and all of our podcasts on the Albuquerque Journal website, abqjournal.com, as well as YouTube, iTunes, and Spotify. See the show notes for a discount code on a digital subscription. Thank you for supporting the Albuquerque Journal, New Mexico's leading news.
Hi, my name is Jay Newton-Small, and I'm executive editor of the Albuquerque Journal. I'm here subbing in for our esteemed Business Outlook team, who are all off doing very important business reporting. But I really wanted to also do this podcast myself because it's near and dear to my heart. In my previous life, I ran a startup in the longevity space, helping seniors cope with healthcare issues. And this startup is doing something very similar. So I'm really excited to welcome COO Evan Thompson of Senior One, who also founded Senior One, and Tim Hart, who is the new CEO of Senior One.
CNM is truly one college with infinite possibilities in tech and data sciences. CNM offers programs where everyone can learn about software, apps, or how to build websites. You can also choose from AI programs and machine learning, the Internet of Things, and so much more. CNM, one college, infinite possibilities, and a proud sponsor of the Albuquerque Journal's Business Outlook.
Evan, I'm going to start with you. So you founded Senior One. Can you just tell me a little bit about the founding story and your own story here in Albuquerque?
Yeah, thanks, Jay. So I grew up in Albuquerque, New Mexico. I actually graduated from University of New Mexico, and I was in pharmacy school at UNM. And one of the things that I got to do while I was in pharmacy school was working for a local pharmacy was deliver prescriptions. And I was delivering prescriptions to a lot of the senior community here in New Mexico, which, to my surprise, a lot of these folks were isolated, lonely, without any adult children. And sometimes as the individual bringing by the prescription, I was the only visitor for the week or the month or sometimes 6 months. And so I really grew close to these individuals that I regularly delivered the prescriptions to. And it started with, can you get the paper towels off the top shelf? Can you wheel the garbage can in? And then these questions evolved and turned into more healthcare related questions like, do you know the best assisted living in my zip code? Will my Medicare pay for this home care service? Can I get my oxygen delivered? And I'm throwing up my hands going, I'm not sure. Call the doctor, call the pharmacist. And really, the more research that I did, I realized there really wasn't a home base for seniors here in New Mexico or really across the nation that helped with all these kind of challenging transition questions as you're going through these, really your aging journey. And so that's really how Senior One was conceived, was kind of firsthand hearing it from individuals who were struggling navigating this very issue.
Awesome. And so when did you meet Tim?
Yeah, so I met Tim after he moved to New Mexico, slightly after the pandemic, as I was kind of networking through the New Mexico business community, looking for really a partner who would help me kind of grow and scale this business. And with Tim's experience in a similar space that had a lot of overlap with the senior care continuum and senior care in general, it really ended up being a perfect match. So it really was through kind of networking in the New Mexico business community.
All right, so just to give you a little bit of a download here, so Evan was the original CEO of Senior One, but now Tim has now joined Senior One, and he's the new CEO of Senior One, and he's bringing really a huge wealth of business experience. Tim, can you tell me a little bit about your background and how you ended up in Albuquerque?
Yeah, so my background is in not in healthcare, but it is in technology. Most of my career was in travel technology. And founded a company in Atlanta, grew that, through the years in Atlanta, and ended up selling it to our largest competitor. Then ran a company in DC as well, as CEO there. And again, these were travel tech companies, largely around data and analytics. But I came to Albuquerque during the pandemic when my wife and I were concerned about her elderly parents. And so we decided to take a cross-country trip in 2020 from DC to Albuquerque and rented a house for a month and got about 2 weeks in and said, I think we need to stay, right? Because her parents' needs were, increasing. So I had seen my parents through their, aging journey. I was kind of Johnny on the spot for my dad as he was, nearing the end. And so I had this sense of how difficult it is for caregivers, who are dealing with so many complicated issues. So I was kind of primed and ready for when I got to New Mexico. Started looking at different startups that I could support. Evan came along, and it was a no-brainer, right? That just fit with my desire to help, my in-laws and just seniors in general. So the one thing I would say about my background, health, travel tech and healthcare, well, that's something completely different. But as we get into talking about Senior One, what I realized was a lot of the healthcare challenges are a challenge of distribution, right? A very complex, fragmented network of providers. And how do people navigate that? And then, so connectivity, technical connectivity, but also human connection in the middle of it. And so you kind of go, well, there's no travel agents in travel anymore. And it's like, oh, yeah, there is, right? If I'm going to fly to New York, I don't need a travel agent. But if I'm going to go to 18 destinations in Europe, right, I don't really necessarily want to, piece that together myself. So it has commonality that said you have this highly fragmented, complex navigational world, and it's very similar, right? But in healthcare, it's people's lives at stake, right? It's how do they get the care they need, when it's very confusing, and so it's really what we're all about.
Awesome.
Yeah.
So I'd love to just talk about the original business plan, the original sort of product, and what you're putting out on the market. What are you selling?
Yeah, I think it's evolved so much just in the last really 18 or 24 months, but it originally started as an online directory. And my goal, as I was getting these questions from these seniors and individuals that I was delivering prescriptions to, was to really aggregate a list of resources, whether it was senior housing communities, in-home care options, medical supply companies, even primary care physicians, because there really wasn't one central place or home base that folks could navigate and find these services. And so it started as this online directory. And to supplement the online directory, I published a tangible resource guide that was delivered to grocery stores and senior centers. And what started to happen was folks would pick up this directory at the grocery store or find us online, and then they would call me and say, hey, I saw ABC assisted living and XYZ assisted living. Which one do you recommend, and which one's a better fit for my mom with these medical conditions? And the more that I started to get those calls, I realized there was much more of an opportunity, as Tim originally said, to really put a human in the center of these transitions. And the business has now evolved to having local licensed social workers as kind of the, really the hub of the operation, acting as kind of care advisors or care transition experts that are, trained, experienced, licensed professionals that help guide folks through these very transitions. And that's really what we've evolved to do today, is that hands-on, personal touch in helping folks navigate these transitions.
So was the social workers and the human at the center your idea from the travel industry?
No, but it was one that I believed in right from the get-go, right? So, I saw the corollary there, and it will always be part of our mission. I think, everybody wants to solve problems with pure technology, and we're a tech-enabled business, but not a tech business, because we have such a belief, right, that people in the situations that they're in as they age and their caregivers, they need a human to talk to, and they need somebody to knit the whole thing together. So it wasn't my idea, but I really believed in it from the start.
Do you have any stories of success here, like one of your social workers helping out a family that really, was having trouble?
Yeah, many. And that's something that we are, in the process of really kind of cataloging a lot of these stories over the time, because we have, so many seniors that have had, no adult children or really no support system in place that have come to us basically, saying words to us as, I was just going to go without care because I didn't know who to call or where to start. And these success stories of folks calling us and us being really the lifeline into helping them understand, did you know that your insurance will cover XYZ? And you can have a caregiver that will come to the home to help you do these certain things. And so many times over and over, it's just the simplicity of making sure folks are aware of the resources that exist. And to Tim's point, these services, are out there, but the hard part is, really finding these hard to surface resources and connecting them to the people at the right time.
And so where does the technology come into play?
Well, I think first and foremost, just to make the whole thing efficient. That's probably the way to think about it, right? That what our technology does is it connects everybody in the network. And when I say the network, that's the provider network. And so we're connected to skilled nursing facilities who were really a very large proportion of our, inbound patients or customers come from, the seniors or their caregivers. So, we're connected to them. We connect to all the downstream service providers, whether that be home health care, non-medical home care, hospice providers, assisted living facilities, and so forth. And so for us to operate efficiently in providing the care, we need the technology to be working for us. So it's connectivity, it's, all the document, HIPAA compliant document, sort of transfers that need to take place, all the chatting back and forth between the providers, and our team, all our ability to track, sort of what's happening so that we can, demonstrate outcomes, from our service. So there's a lot of tech. Right? There's a lot of tech. But it's supportive. It's not the point.
Got it.
Is probably the way to think about it.
And how many users do you currently have?
Yeah, I think just this month we surpassed our 3,000th customer, which was really exciting for us.
That's amazing. Congratulations.
Yeah, thank you.
It seems like it's a huge opportunity. I mean, the market is only going to expand. We're about to see the baby boomer generation retire and start to need, frankly, care and services like these. Is there a plan to expand this beyond Albuquerque?
Absolutely. Yeah, they call that the boomer, rat through the snake kind of bubble that's happening, the silver snot tsunami, right? So it's big, right? The stats are something like, the population of people in this sort of stage of life is doubling right over the next 30 years. So it's the need is immense. Yeah. So yes, certainly. I mean, we really believe passionately in what we're doing, right? Which, again, we feel like, the care providers themselves do such a good job, but they don't really have the time, right? And really the resources to manage all these transitions, from place to place. And they only see as far as the next discharge, the next, sort of step that patient needs to go. Our belief is we're going to follow these, we're doing it, following these patients long after their last encounter, right? We're going to follow them for life. And so, we believe passionately in that mission. That doesn't change, when we leave New Mexico and go into some other, location. The same issues, the same challenges are happening there. So yeah, that's really where I come in. Quite frankly, is I'm a scaler of a business. That's what I love to do. If we have something that's really working well here, and we've been focusing on making sure it works really well here before we take it elsewhere. But yeah, our plan is to go as far as the plan will and success will take us. We'd love to be able to be working nationally, but we have to start regionally, to make that happen. And so, yeah, that's our goal.
Tell me a little bit more just about the business model. I mean, so is it like a subscription service where you charge a monthly fee and then handle lots of things? Because I can think of a million things that seniors need, right? Like they need help with their gardening, they need help with their chores, they need help with like decluttering or moving and like sort of sending things to estate sales. They need help with healthcare, obviously, is the huge one. So what kind of suites of services do you offer, and how do you bring in revenue?
Yeah, I think it was super important to me from when I first started delivering prescriptions to the pharmacy is that, folks of all socioeconomic status need help. No matter the resource you have or the resource that you don't have, it's still extremely challenging to navigate this space. And so it was super important for us to make this service free to the consumer, the senior and the caregiver, and to have other ways of, funding and monetizing the business. And so right now, the tech, as Tim mentioned, it's basically a closed loop referral system that is attached to all these different points in the care continuum that allows us to efficiently, guide patients through these transitions, whether it's discharging from skilled nursing back to home, discharging from their home health therapy at home to potentially bringing in a non-medical caregiver. So the way that we currently fund and monetize the business is, subscription or licensing fees from the provider network. And then in some cases, there are fees that are collected for individuals that move into senior housing communities, what we call, a placement fee, which is kind of a traditional, way that the market works. And I think, we have goals and aspirations of moving away from that model, because in some ways you could look, from the outside looking in, it can make us look biased, which we truly are not. And so I think the goal is eventually to move towards this, full licensing model, whether it's with hospitals, skilled nursing facilities, et cetera.
So it'd be like a B2B model.
Yeah, exactly. Mm-hmm.
Interesting. Well, actually, that sort of brings me to the question of the evil empire, and that would be A Place for Mom. And it's pretty renowned in longevity circles as being sometimes not the most honest of actors, maybe getting a little bit too much money from the folks that are paying them and not necessarily in the best interest of the folks they're trying to serve. So now those obviously accusations have been sometimes proven, sometimes disproven, but it doesn't have the best reputations, right? So is there a plan to take on somebody like A Place for Mom?
Sneak up on them. Really honestly, because we feel that we're doing something so completely different where, their business is just the sort of the tail end of what we might be doing, right, for, our customers, our patients, our seniors. Honestly, what they do and how they do it, I'm not a big fan. My story about it is when I started getting involved with Senior One, and I was sort of figuring out, did I want to get involved? I said, well, let me just sign up for Place for Mom and see what happens. So I think it was a Saturday. I just went on their site and signed up, put in my information, and my phone rang, and I'm not exaggerating, 25 times probably in 24 hours.
Wow.
Because not only was they following up, but they send all my information out to literally everybody in the marketplace, and they're all following up. And so the way I look at that is that's exactly what a senior does not need at that sort of point where they're really trying to figure out whether it's the caregiver figuring out where they're going to put their loved one, right, or the senior, just trying to figure out what they're going to do. They don't need, 25 calls in 24 hours. So it kind of inspired me. Right, to say, yeah, well, we don't want to do that, right? But for the most part, it just said, no, that's just one need. And so we just believe that we're positioning ourselves to help, every senior with all their needs, really, from a navigation standpoint. We're not a care provider, right? So we're not doctors, we're not nurses, we're care navigators. And so, but we want to make sure that no senior falls through the cracks at any point in their journey, not just the tail end of their housing need. So I just look at them as more of an inspiration for kind of how we're different and how we want to, solve the problem more holistically.
Is there anything I haven't asked or anything that I've missed?
Oh my, we could talk about this business forever, but yeah. No, Evan, do you have anything that you might want to add?
I don't think anything in particular. I think it's been really, exciting on one hand to see how the business has evolved and grown since I first started it, but also, really fulfilling on the other hand, how many, to your point earlier, Jay, how many success stories we have and how many folks that we've helped of all socioeconomic statuses and not just with their housing needs, folks who are confused about, potentially how to apply for Medicaid. Are they eligible for Medicaid? What services are there, available for them in rural New Mexico? And especially a state like New Mexico where we're so vast, it can be challenging for folks who aren't kind of in the metro area. And that's something that has been really exciting and fulfilling for us, is just being able to help the whole state and this population that a lot of times goes, kind of unnoticed or underserved.
And where can our readers and listeners or watchers find you guys?
Yeah, we have a website that is accessible to seniors and caregivers who are perusing online, which is just www.senior.one. There's no .com or .org. It's just www.senior.one. And then we do have a phone number that is answered by a real local licensed social worker here in New Mexico. And that phone number, it is an 888 number, but we are local to New Mexico, and that's 888-888-2191.
Awesome. How many, just a following question to that, how many social workers do you have working with you now?
Yeah, right now we have 3 local licensed social workers, and then we have care coordinators that supplement the kind of the heavy lifting that the social workers and the care advisors do.
Great. Do you have a sense of your volume of calls? Like how many calls do you get every week?
Oh my.
Yeah, I think right now we're probably averaging between 70 and 80 calls a day of folks who are navigating this very issue that we've talked about over and over. So it's, again, we're learning new things every single day, new problems that are arising, whether it's in a skilled nursing facility or at home. And I think that's what's been really exciting and, fun for Tim and I to watch from the social worker standpoint is we're giving these social workers the ability to really help people without any box. And so they don't have any particular service that they're trying to force upon the senior. It's really looking at the senior in a more holistic way and saying, how can I help this individual thrive, whether that's at home, in a senior living facility, or wherever.
Well, I'm super excited to see what you guys do as someone who also came to New Mexico on a road trip from DC in 2020. I love the idea of folks coming in this latest influx of, I could say, immigrants to New Mexico, but bringing wisdom, bringing expertise, being able to help companies here scale and take their services outside of the States. So I really look forward to, in the next year or two, bringing you guys back and talking about what happens next.
Awesome. Thanks, Jay.
Thank you, Jay.